Hello friends, today we will learn about the mandibular nerve. So as you know that mandibular nerve is a branch of trigeminal ganglion, the fifth cranial nerve, that is trigeminal nerve. So one of the important branch of this trigeminal nerve is mandibular nerve. And the two branches of this trigeminal nerve is maxillary and the ophthalmic nerve. So in this image, you can see the cranial fossa. We are looking at the skull from its interior aspect. Interior. We are looking at the skull of the inside. So this area is of the anterior cranial fossa. This is the area of the middle cranial fossa. And posteriorly, this area is of the posterior cranial fossa. So here on this petrostemporal pole, you have an impression that is known as trigeminal impression, and on this impression lies the trigeminal ganglion. From this trigeminal ganglion, you can see there are three branches. One is the ophthalmic nerve, the second one is the maxillary nerve passing through the foramen rotundum, and this third nerve, which is passing through the foramen ovale, is basically the mandibular nerve, which is the third branch of fifth cranial nerve, that is trigeminal nerve. So today we will see the detail of this nerve, that is mandibular nerve. So let us see the mandibular nerve. Mandibular nerve is because it is a branch of the fifth cranial nerve, and this is the inferior and the largest division of trigeminal nerve. It is a type of mixed nerve because it carries the sensory fibers as well as the motor fibers. So here you can see these are the branches of the mandibular nerve, and this mandibular nerve, you can see here, this mandibular nerve, after passing through the foramen ovale, this divides into it comes out to outside the cranial cavity, and then it gives two branches. One is the anterior division and the one is the posterior division. So before the foramen ovale, this is the trunk of the mandibular nerve, and this mandibular nerve, the trunk of this mandibular nerve gives two branches. One is sensory, that is the meningeal branch. This blue color is showing the sensory part of the mandibular nerve. This orange color is showing the motor part of the mandibular nerve. So from the trunk of this mandibular nerve, there arises one sensory branch, that is meningeal branch, and the motor branch, that is nerve to medial pterygoid, the tensor palatini, and the tensor tympani. They are arising from the trunk. Now, after passing through the foramen vein, now this trunk divides into anterior division and the posterior division. This anterior division basically composed of motor component, so it gives branches to the muscles of mastication such as deep temporal to the temporalis, the lateral pterygoid muscle to lateral pterygoid, and the branch to masseter, that is masseteric nerve. One sensory branch that is arising from the anterior division is the buccal branch. So the anterior division is basically motor, but one is buccal branch, which is sensory in nature. Now moving on to the posterior division. The posterior division is basically sensory part, but it also carries one motor branch. You can see here this orange color is showing the motor fibers. This blue color, dark blue color is showing the sensory fibers. So from posterior division, the first branch that is arising, which is known as auriculotemporal nerve, it encircles the middle meningeal artery. This auriculotemporal nerve is basically sensory, and it supplies to the area of the skin over the temple, it supplies to the temporomandibular joint, and it supplies to the parotid gland. The other sensory branches is one is the inferior alveolar nerve and the one is the lingual nerve. The lingual nerve, which is the sensory or which carries the sensory fiber, it supplies the anterior two-thirds of the tongue for the general sensation. The inferior nerve, alveolar nerve, gives one branch that is known as nerve to mylohyoid. So this is nerve to mylohyoid arising from the inferior alveolar nerve. So this nerve to mylohyoid supplies to the mylohyoid muscle and the anterior belly of digastric. So the posterior fibers or the posterior division of mandibular nerve is basically sensory, but yes, it is having the motor component, that is nerve to mylohyoid. The anterior division is basically motor because it mostly supplies muscles of mastication except middle pterygoid. Then one sensory branch, that is buccal. This is all about the mandibular nerve. Thank you.